Hi, everybody, and welcome back to the Optimove podcast. In this episode, Dr. Guild tells us about spotting injuries that seem fatalistic but really are not. They can be spotted months and even years or decades in advance by observing the way the person moves at a basic level. He also calls on his expertise from when he used to be a certified strength and conditioning specialist before becoming a physical therapist to tell us about how we can improve the effectiveness of our workouts and avoid injuries simply by changing what we focus on during the exercise. Dr. Guild often says that these seemingly random injuries actually could have been predicted well in advance in a lot of cases. We'll pick the interview up when I ask him to explain that to me in a little more detail.
Yeah, and if you think about what the common person might experience as they get older, so they get into their 30s, 40s, 50s, and all of a sudden, they get a shoulder injury. And then, they have neck pain, and then they're getting knee pain as well. And all these injuries that start small and they just keep building and building and building. And, they might have to get shoulder surgery. They get a quote unquote, torn rotator cuff and quote unquote impingement at their shoulder that their doctor or physical therapist tells them. They get knee pain, they maybe have surgery for that. And then they start thinking, well, I have arthritis and, my mom had arthritis. And so I'm just destined to have arthritis and all these things, right? Or I'm in my 30s and 40s and 50s and this just comes with age. Everything starts going downhill, right? When we get to this point. And the reality is these are things that are predictable and preventable months and even years and even decades into the future. So these things are controllable and we can prevent them. And I think that's the main takeaway for today is to gain the understanding that we have control over these things. It's not just about getting older. It has something to do with it, but it's more about the wear and tear on our body over time. But what creates that wear and tear? It's the forces, it's the loading, it's the angles, it's the torques on all of our joints, the way our body moves throughout our life that leads up to these things. And a lot of these things are predictable months, years, and decades in advance because we tend to start developing these problems very early in life. And these problems tend to accumulate as we get older. And then by the time we do get into our 30s, 40s, 50s, these injuries start showing up and they appear random. Or you can think of a younger person, let's say they're working out or an athlete, and then they get that kind of random shoulder injury or they get that random back injury or hamstring tear. Those things are also predictable as well. And it's not always about they're lifting too heavy or it's not always the workout itself. It's the way that their bodies move at a basic level. And if we can figure out the way our body moves at a basic level and correct that, then we can prevent these injuries that appear completely random, but they're not random. They're predictable, they're foreseeable with the trained eye, and they can prevent months and years and decades in advance. And that's the most powerful part.
How is this concept first developed? How was it first used?
Originally, this started being used with elite athletes, a couple of decades ago. So some of the leaders in this area, Gray Cook, Shirley Sarman, Chuck Wolf, Gary Gray, these sorts of people. So physical therapists and strength conditioning coaches that were on the front end. Mike Boyle, another example. And they were leaders in this idea that if you find the way that people move at a basic level, you can prevent injuries in the future. And they were taking that concept with elite athletes because if you are working with Division I athletes, let's say, and they're getting random injuries, well, that can set them back for several games. It can set them back for seasons and even the whole career. But if you can prevent those things, then you can improve the life and the quality and the longevity of that athlete. And that's very, very powerful as a strength conditioning coach. So what it began with is spot these basic movement problems with elite athletes because elite athletes are great compensators. They can do all these high level things and they can do all these things phenomenally well. But when you break their movement down at a basic level, it turns out most elite athletes don't move very well at all at a basic level because they've been doing so many high-level things for so long, and they may have had injuries in the past. They may have a movement problem that just kept feeding into itself over and over. They might have basic alignment problems or whatever, but their body just adjusts along the way, and they start developing all these different compensations. And with elite athletes, it's very, very individualized, even more so than the general public, because they're such great compensators. So strength coaches and physical therapists had this problem of, okay, we have to solve this problem. Like, injuries cannot be random. And if we break their movement patterns down at a basic level, we can start to correct these things. And so you might take an entire group of elite athletes, and if you take a day or two, screen all of them, see how they move at a very, very basic level, find the movement pattern problems that tend to exist, and then implement intervention, so corrective exercises for those athletes. Then you can prevent those random injuries that tend to come up into the future. Not trauma related, of course. So, if they hit somebody else on the field, you can't necessarily prevent that. But it's the random knee injury, the random hamstring pull or tear. It's those sorts of things that you can correct, or even the way that they're able to absorb trauma or shock. Because if they're more stable overall, if their spine is better aligned, if their knees and hips are more stable, then they can take on the forces that are confronted with them. So that's how it started off, is with elite athletes. And so the great thing is we can take these concepts and apply it to the general public. With the general public, yes, it's a little bit less individualized compared to elite athletes, because tends to not be quite as much compensation. So in some ways it's a little bit easier to do with the general public, but you're also working with a population that can be more medically complex, for instance, and also an older population. So that has its challenges as well. So applying the concepts with elite athletes to the general public is very beneficial. And so you just break people's movement patterns down at a basic level, and then basically go from there to prevent those random injuries that tend to occur in our 30s, 40s, 50s, 60s, 70s.
What is compensation, and can you give us a few examples of it?
Yeah, so compensation is basically if you're not moving well, or you have an injury or pain in one area, you're going to start using a different area of your body or a different movement to make up for the weakness or the movement problem in the other area. So a simple example might be if someone has a weaker hip on one side compared to the other side, when they're doing lunges or they're doing step ups or they're climbing stairs, the side that is weaker, the knee might turn in. And then you have a balance problem as a result. So what the person might do is they might just turn their foot out, right? But then all that together puts increased stress on the knee. And so the problem is being solved on the front end of it, whereas, okay, they can do their lunges or step ups or climb stairs and be stable despite the fact that the hip is weak, but the knee is going in and then the foot is going out. And so you have all this torque going on to the knee. Now, if it's a younger person, they may not feel pain. And so they keep doing this all throughout their life. And then it might be a couple decades before they start having knee problems. And so all these other tightnesses and weaknesses can occur. Another great example is if you've had surgery and, your knee doesn't straighten out all the way for a while. And then as a result, you start moving differently, if that makes sense. So all these things that tend to happen throughout our lives. So compensation, just basically making up for things that, okay.
What are some common movement problems among younger people?
Yeah, and if we think of it at a basic level, and we could, this could be an entire semester of teaching or entire couple semesters of teaching, but some very simple basic things that people can start addressing on their own throughout their lives. So ankle mobility is a big one. So if the ankle doesn't bend upward very well. It can be a flexibility issue, meaning if they simply start stretching their calves on a regular basis, that can help solve the problem. Sometimes it's the joint itself. That's a whole nother issue, and that takes a little bit more of a specialist to address. But it can, a large percentage of the time, it's just calf tightness. And if we start correcting that problem, then that can help with a number of different things. One, if they're working out, they're training in the weight room, when they're doing squats or deadlifts or, these types of things, you'll start seeing a lot of compensations happening because the ankle doesn't move well. So it starts from the bottom up, and the way the ankle moves at the level of the ground then affects the entire body all the way up. So then the knees might have to move forward. So that puts stress on the knees. It can put more stress on the back, because then their back might have to overly arch in order to make up for the fact that their ankles don't move well. And these are common problems that we might see amongst the general public and with elite athletes. So ankle mobility can cause a lot of problems. It can also create problems with shock absorption. So if you think of the back of our legs, the calves and the hamstrings as shock, like similar to shocks on a car. If you're running and jumping, and you're walking and living your life, if those muscles are excessively tight, that can limit the ability for our bodies to absorb the impact from the ground. And so that goes straight up then to the back or higher. And so then we start getting problems up at the back because of tightnesses from the back of the leg, the calves and the hamstrings, which of course then leads into ankle mobility as well. So all this feeds together. So if our ankles move well, and if we're mobile in our ankles, then we can move much more easily. If we're squatting or standing up from a chair, we may not have to lean forward as much, for instance. That's another compensation. That tends to happen when our ankles don't move very well. And so we see this a lot with younger people. I would say, about 90% of the population, at least the American population, our ankles don't have the right amount of mobility. And so we don't squat well. We don't stand up from a chair well. Of course, as we get older, we tend to have these problems as well, but we start seeing this with younger people, especially with the type of workouts that younger people strive to do. Ankle mobility is a huge problem as they're doing squats and all these things. So starting with from the ground up, starting with ankle mobility is very, very powerful. Another problem we tend to see with younger people is, I like to call it leg dominance over hip dominance, or you can also think of it as, if you're looking at the upper body, arm dominance over trunk dominance. So overall, basically what people tend to do is they tend to use the muscles that are smaller and are in their arms and legs, because it's easier to contract, it's easier to control. And so they'll use the smaller muscles in their arms, they'll use the smaller muscles in their legs to do things. So they'll use mostly their quadriceps that straighten out the knee. They'll use their hamstrings a lot to both straighten out the hip and to bend the knee. When better to use the larger muscles that are closer to the body, closer to the trunk. So when we're doing squats, let's say you're standing up from a chair, if we're excessively using our quadriceps to straighten out the knee rather than using more of the muscles in the hips and the glutes to straighten out the hips as we stand up, then we can reduce the wear and tear on the knee because we're not using our quads too much, if that makes sense. So activating our hips to be able to lift ourselves up from the hip rather than just putting a lot of torque on the knee to stand up. Another, with the upper body, it might be if we're doing pull-ups or we're just lifting things overhead in general, excessively using the arms, the biceps and the triceps, instead of using the shoulder blades. Most people don't recruit their shoulder blades very well. So we don't connect our mind to our body well enough at our shoulder blades to do pull-ups well, let's say, in the way that they were intended. People will use their biceps too much when they do pull-ups as opposed to using their shoulder blades. And so what that, of course, increases wear and tear on the body because we're using smaller muscles for very large movements. And so the smaller muscles can't take on that load. And we end up getting injuries as a result by not using muscles closer to the body, and those muscles are much bigger than the muscles that are farther away from the body, which are much smaller. And this is partly a compensation issue, but it's also just a mind-body awareness issue. And if we can correct those things, then we can prevent a lot of injuries as people are working out and even just living their life in general.
I've heard you say often that you can recruit different muscles during an exercise by just thinking about them. Can you tell us how that process works and how we can use it?
Yeah. So we have a lot of control over the way that we move, and that just by simply thinking about the muscle that we're using can change everything. So our brain has the ability to think about what muscle it's using, assuming that there aren't any mechanical things getting in the way. So if we choose to use our shoulder blades to do a pull-up, let's say, right, rather than using our biceps, then our mind can connect to our shoulder blades and recruit those better, if that makes sense. Now, there can be some mechanical things that get in the way. One, if it's just the load is too heavy and we can't do it, that's one problem. So we might have to lighten the load in order to recruit the correct muscle. Sometimes there can be some mechanical things that can get in the way, like the muscles in the neck can be too tight. That might lift the shoulders up and prevent us from being able to recruit the shoulder blades properly. So then we got to go and lengthen out the muscles in the neck in order to get to the shoulder blades. And so this is the skill. It's a mechanical, it's a mind-body connection neurological problem, but it's also a mechanical problem as well. And so you have to address it from both sides. And this is where it gets so complex. Or very simple, however you want to think of it. So address the mechanical problems while you're addressing the mind-body connection problems, because usually it's both. And then oftentimes what we'll see is, and you talk about compensation. So let's say you get an athlete who got knee surgery, and you're able to get their knee to straighten out all the way again, whereas before, after the surgery, their knee bends when they're walking, and for several months their knee may not straighten out all the way, but when they walk, you finally get to the point where their knee can straighten out all the way, but their body has gotten used to the knee bending when they walk. So the brain then remembers bending the knee when walking, even though mechanically it's been fixed. But the brain remembers that movement that's done thousands and thousands of times, and it'll keep doing it. So even though you correct the mechanical problem, you then have to go back and correct the mind-body connection problem. Not always, but often. And so then you have to go back and retrain that movement. So the way that the mind connects with the body. So whether it's a movement pattern, such as straightening out the knee all the way, or you can, back to the example of the pull-ups, you can try to recruit the shoulder blades to do pull-ups, or the upper back, however you want to think of it. Now you might have the tightness in the neck that's preventing you from getting to be able to use the upper back. But then you correct the mechanical problem, but then the person has to still then be able to connect their mind to their upper back to do the movement. So you have to accomplish both at the same time. So you have to correct the mechanical problem, but then you also have to get the person to get their mind to recruit the correct muscles. Another common movement problem with younger people is asymmetry. So if one side is much stronger than the other. So if we take somebody who, let's say their hip muscles are weak on one side, their core is weak on one side, that's going to cause a lot of problems, more so than the person, let's say their core is weak in general, and their hips are weak in general, if that makes sense. The person who has one side that's much stronger than the other is more likely to get injured than the person who's weak on both sides. Now, of course, we want to be strong on both sides overall, but if we're looking for movement pattern problems, and again, this is very true with elite athletes, it's true with the general public. We need to look at both sides of the body, break down both sides of the body, and make sure that both sides are moving well, make sure that the motion is there correctly on both sides, and also the strength is there on both sides. And if one side is moving worse than the other, then we're more likely to get a problem than if both sides don't move well overall. So symmetry is important. Of course, none of us are symmetrical. We're human. But to be able to address that problem as much as possible is important. And the problem can be the injury can come from the side that's stronger because it's putting in more work and getting overworked. The problem can be on the weaker side or the side that has less motion, shall we say, right? It can happen on either side. And so we want to make sure that we're addressing the symmetry problem. And that's very, very common amongst younger people and elite athletes, that asymmetry that's there. And of course, they'll do higher level things, they'll play sports, they'll work out, and then that asymmetry just builds and builds and builds into an injury as they're doing more and more things. So if we spot that ahead of time, we can prevent those sorts of injuries. A very common problem we'll see with younger people is, and surprisingly maybe, is lack of control of the shoulder blades. And we touched base on this a little bit before, but if we can't activate our shoulder blade muscles properly, then that tends to cause a lot of problems. It can cause problems in the back, lower back pain, can cause problems in the neck, it can cause problems in the shoulder. And basically, we need to be able to pull our shoulder blades downward when we're doing a lot of things in life, whether we're pushing an object away from us, whether we're pulling an object towards us, if we're reaching overhead, putting dishes away, if we're pushing weight over our head, our shoulder blades need to work in a certain way that makes it very mechanically appropriate, shall we say, to reach overhead or to push overhead or to pull things towards us. And the reality is people tend to sit too much. We tend to do a lot of things that takes away this shoulder blade control and the muscles around the shoulder blades. And so mechanically, we're not optimized there. And we find this very early in life. And it can cause a lot of problems, especially because younger people might be pushing weight overhead when they're working out, when they're exercising. They might be doing handstands. There's all sorts of different things that younger people will do. And if they're not recruiting their shoulder blades well, then that can cause a lot of increased risk of injury. Very similar, the mechanical cause to not recruiting the shoulder blades well. We talked in the past about that neck tightness. So mostly if you think about the upper trapezius, which is kind of the big, bulky neck muscle you'll see on bodybuilders, who actually they have very phenomenal length in that muscle. Just it's very bulky. And if you'll notice, their shoulders are very low compared to their ears. But what's in between their shoulders and their ears is that big upper trap muscle. So their posture is actually phenomenal because they have to train for symmetry. It just looks like they don't have a neck, but actually they have a phenomenal neck. But the important thing to realize here is that muscle tends to get over tight, over dominant on most people. This is true with younger people. It's true with older people. And so it'll lift their shoulders up. There's very little space between their ears and their shoulders. And so that tightness in that muscle will then also shut down the ability for that person to use their shoulder blade and upper back muscles properly. And then when they go and reach overhead, that upper trap muscle will lift the shoulder up. They can't use the muscles properly to pull their shoulder down. And so that increases risk of injury in the neck, in the shoulder, and on the back because it's pulling that person forward, lifting the shoulders up and rounding the back. And so it causes problems all the way down the body when just that upper trapezius muscle, that muscle that's around the neck, is excessively tight or excessively short, can't recruit the upper back muscles properly, posture is affected, and so we're not able to do all these things that we want to do in our life, pushing weight overhead, reaching up for dishes, reaching up for shelves, doing handstands, whatever we want to do. All these problems feed into each other, and then we're at increased risk of injury as a result if they're not corrected.
Another issue you commonly talk about is posture for younger people.
Now, we can take an example of, let's say, younger people who, let's say they're not elite athletes, or they're not as physically active, or they're not going to yoga classes or Pilates, and they're not in the weight room all the time, right? So people who are not doing those things. Because we've talked a lot about people who are physically active and elite athletes. So let's take a younger population that, let's say they're not as physically active. Posture can become a huge problem. And this posture can be a big problem amongst those who are physically active as well. But for those who aren't as physically active, posture becomes a big problem. It's sitting in the chair all day, it's going to class, it's sitting at work and typing on a computer all day, it's looking at our mobile devices, and so our head goes forward, our eyes go forward, our shoulders go forward, and we get this kind of slouched posture. So then that becomes problematic because, again, the muscles in the neck tend to become tight, the upper trap becomes tight, the upper trapezius that we talked about, their ability to use their shoulder blade muscles becomes more problematic. And then that goes all the way down to the back. But then from the feet on up, of course, there's the ankle mobility problem that we talked about. But then also, if they're sitting all day, their hamstring muscles in the back of their legs start becoming very, very tight. And you can think of someone sitting in the chair and their tail is tucked underneath them and they're slouched forward. The hamstring muscle in the back becomes very, very tight. The lower back muscles in the back become very, very weak. And the upper back muscles become weak as well. So then the posture becomes a problem. And then from there, it's important to understand that low back pain doesn't happen just with older people. In fact, you can think of it as quite the opposite. Because younger people tend to have more fluid between their vertebrae, right? So older people might talk about how, well, I'm shrinking because of the fluid between my vertebrae is going away because their doctors told them that, and they've read it and everything else. So it's a reason why they're shrinking. So younger people have more fluid between their vertebrae. That can be problematic because that fluid can more easily be pushed outward and then press on the nerve. And then you get the back pain with the radiating pain down your leg. That tends to happen from that slouched posture, from bending down to pick up something, and the hamstring is pulling the pelvis downwards, which pulls the back into a rounded position. And so then you can't bend down and pick things up very well. Let's say you go and you bend down to pick up your children, your back is rounded, your tail is being pulled underneath you. And that type of posture puts a lot of pressure onto the disc of the back. And then that fluid that is there with younger people tends to get pushed outward. And then they're at higher increased risk of disc herniations and things like that. And then so that can be a long, long recovery. So posture is very, very important to get the spine in a proper alignment so that we're able to bend down and pick things up properly, being able to bend at our hip rather than rounding from our back. And it's not just always about lifting from the legs. That can be a very simple way to think of it, but more importantly, to bend at the hip, more so than lifting from the legs. We need to be able to bend from the hip. But if the hamstring is excessively tight because we're sitting too much and it pulls our tail downward, it can become mechanically impossible to bend at the hip to pick something up. And back to, if you fix the mechanical problem, but then don't train the movement problem, then you may not have addressed the problem. So you can lengthen out the hamstring, so then you're not getting that pull on the pelvis that rounds the back, but then you have to also teach the person how to bend at their hip properly. And that can be very, very difficult to do, especially for someone who has been rounding their back for a long period of time. So you have to change the way that someone moves.
Okay, so you've told us a lot about common movement problems you see with younger people, but what about common movement problems among older adults?
Yeah, a very common one there is, we just talked about posture with younger people. So common, very similar with older people, some of the same things, right? So sitting too much is a problem with older people as well as younger people. So of course that hamstring tightness, the muscle in the back of their leg, it pulls their tail underneath them. So you'll see older people where their tail is pulled underneath them and they walk with their knees bent because their hamstring becomes so extremely tight, and very, very common problem. And of course that creates kind of a caving in type of problem with older people because the muscles up in their chest are also tight as well. Their shoulder blade muscles don't tend to work as well either. They might have a lot of, should we say, knots and connective tissue tightness up in the upper back. And so that's being rounded forward as well. So they're kind of forming into a ball. And eventually they'll even complain about their ribs caving in on them and even breathing problems. This becomes a little more extreme, but that's kind of where the posture takes them. So the hamstring pulls the pelvis downward, and then they walk with their knees bent, their tail tucked underneath them. Their upper body is being pulled forward, their upper back being rounded, and so they're beginning to form into kind of like a C shape. And then the ribs get kind of pulled inward as well, and it can become very uncomfortable. That might be a posture that they have, but another common one is they also have a lot of tightness in the front of their legs, and a lot of times that also comes from sitting. So hip flexors, if we get more specific about it, so the muscles in the front of their legs pulls their trunk forward when they stand up and when they walk, and that tends to create a lot of problems because then they can't mechanically stand up all the way. Lengthen out the muscles in the front of the legs, and it's amazing how much better that person can stand up all the way. We see this a lot with older people. Our energy level tends to decrease more as we get older. Our activities tend to be more things that involve sitting around a lot more, reading, going out to lunch with friends, and over the years doing a lot of repetitive motions that lead to the muscles in the front of the legs getting tight. And so what all too often happens is older people will bend at their hip and lean forward because of that muscle tightness in the front of their legs, as well as weakness in the lower back muscles. And so all those things together. But then, of course, you also have the tightness in the back of the legs, which then also pulls their pelvis underneath them. So they got both things going on at the same time. So all these things need to be addressed. Now, you could also think about flexibility overall as an issue with a lot of older people for a number of different reasons. So if we can address the flexibility, that can help tremendously. Now, there's the other problem that sometimes flexibility can be more difficult to address as we get older. So really, the sooner we address flexibility in our lives, the easier it is to prevent these sorts of problems as we get older. Because if we find this person by the time they're in their 90s, it can be addressed. It's a lot harder to address at that point. It's more difficult to stretch. The muscles are not as forgiving with stretching and can more easily get flared up with stretching. And these postural problems tend to be more difficult to correct. The spine is not as bendable as we get older. I usually tell people, after about age 70, 75, start to think wherever your spine is, it's going to be more difficult to correct the spine itself at that age. So start earlier to correct your spine rather than waiting until later on in life. It might become too late. Now, that's not to say that in our 80s and 90s we can't correct a lot of these postural problems, because we can. There's a lot of things that we can do. Just we can't be as aggressive. We got to move a little bit slower. We got to be more strategic, more skillful, and we might not be able to correct the spine itself as much, but we can correct a lot of things around the spine. And so all these things feed in together. And create a lot of problems for older people. So if they can't stand up all the way because the muscles in the front of their legs are tight, that can pull them forward. It increases risk for falls. They have problems reaching overhead, putting dishes away because their shoulders being pulled forward. Their shoulder blade muscles are not being able to be recruited as well, and they have a lot of tightness both in the front of their body and then also in the back. That prevents them from being able to reach up overhead, and then they get neck problems and shoulder problems, and this vicious cycle continues to feed on itself into this downward spiral. But a lot of these things are able to be addressed both when they're younger, but even when we find them when they're 95, we can address a lot of these things even at age 95. So it's not too late, but the sooner you start correcting it, the more problems you can prevent. And then another common movement problem with older people is very, very simple. Quad strength and basically mind-body connection to the quadricep, or the muscle in the front of the leg, the muscle, the front thigh muscle that straightens out the knee. That muscle can become weaker, but also it can become more difficult to be used properly. And so that muscle, for a number of different reasons, can begin to shut down as people get older, either because of prior knee surgeries, because of arthritis in the knee. And so what tends to happen is that muscle tends to not create as much torque on the knee if there's a problem at the knee, again, because of surgery or arthritis, or just from lack of use over time. The front of the thigh muscle, the quadricep, doesn't get activated as much as it should be. And so we'll find ourselves spending a lot of time just trying to get that quadricep muscle activated so that the main muscle that straightens out the knee when someone stands up from a chair is actually being used. Now, the person might be able to stand up from a chair, and they might even be able to do it without using their hands, but you'll tend to find those compensation strategies. Again, just like elite athletes, everybody compensates in some way, somehow. And so what you might find is an older person might push their knees forward when they stand up from a chair. They might press their legs into the chair to help them stand up because their quadricep muscle, the front of the thigh muscle, either is weak or is not being activated the way it needs to be. And so the way to address that is first, of course, any mechanical problems that are preventing that muscle from activating need to be addressed, but also retraining the person to use that muscle properly. And that can take a lot of time, a lot of work, and a lot of focus, or it may not take a whole lot of time at all. It's very individualized, but it's very, very important because you can prevent a lot of knee problems and prevent falls, can prevent a lot of issues by addressing that problem. You can prevent the problem of what we call frailty. Let's say with older people, the problem of just them getting weaker and weaker and weaker over time, and the fact that they're not using that quadricep muscle properly, and then they're not using really muscles to stand up from a chair. They're using the compensation of just pushing their knees forward or pushing their leg into the chair to help them stand up, and then using their arms. So they're not using their leg muscles anymore. And so it becomes this vicious cycle. Whereas if you can kind of think of the one thing to get them to be able to get on that upward spiral towards using their muscles properly, address that quadricep weakness or the mind-body connection to the quadricep, so that they're using that muscle to stand up from a chair, can be very, very important and very powerful. Now, ideally, of course, we'd want them to use their glutes, their glute max muscle, to help push their hips upward when they stand up from a chair. But if we're not addressing the quadricep first, unlikely we're going to be able to address the glute max. So if you can think of this as a younger person compared to an older person, with a younger person, usually we're not concerned about the quadricep not firing properly, unless if they've had an injury or surgery or something. Usually their quadriceps are too dominant, and they use their quadriceps too much when they stand up from a chair or when they do squats. And then the focus for a younger person then is to get the hip muscles activated, to get their glute stronger and better activated, to have their glute straighten out their hip rather than so much torque on the knee to do a squat or a lunge or a step up or to stand up from a chair. With an older person, we just need to get their leg muscles activated properly. We need to get them moving properly, standing up from a chair, but then also using the correct muscles, using the main muscle that straightens out the knee to get them to stand up properly. And then once we do that, we're able to address the hip weakness problem and get the glute max to be able to push their hips forward, to be able to propel them upward. But first, we got to focus on the muscle that straightens out the knee. Similar to that issue, again, hip weakness, very, very common problem amongst a lot of populations, especially in the older population. Hip weakness, a big issue. We just don't use our hip muscles very often at all. And these are the muscles that have our legs go side to side. So you can think of activities such as ice skating or rollerblading or roller skating or hockey, things like this, right? It's the main muscle that stabilizes our leg when we're standing on just one leg. It prevents that hip from dropping. It prevents the knee from turning inward. It pulls our knee outward when we're climbing stairs. Very, very important muscles on the side of our hip. And those muscles tend to become very, very weak as people get older just because of lack of use. And so as a result, when people stand up from a chair, you'll see their knees cave inward. Their knees turn in while they're standing up from a chair. It can be inner thigh tightness as well, but oftentimes hip weakness is a large contributing factor to that. And so then you get more knee pain, more hip pain, and more back pain as well, because the hip muscles are not pulling the knees outward when they're standing up from a chair or when they're climbing stairs. And again, it feeds into this vicious cycle of a movement problem that creates more and more pain. People think that it's all about, well, I have arthritis and that's why my knee hurts. But if you watch them stand up from a chair, because of the hip weakness, their knees cave inward, which puts a lot of stress and a lot of torque on the knee that shouldn't be there. And if their quadriceps are weak, then they're pushing their knee forward in order to stand up. And so you get this repeated wear and tear all the time on the body because of the hip weakness and because of the quadricep weakness. Now, if we think about the upper body, common movement problems with older people, back to posture, right? The muscles in the front of their body tend to be tight, so it'll pull the shoulders forward, which is true with a lot of different populations, older people and younger people. A lot of times we'll have, as life goes on, they'll get a lot of should we say, connective tissue problems in their upper back. The muscles around their upper back can become very, very, very tight, and that itself can prevent a lot of control of their shoulder blades as well. It can pull them forward into a hunched position and create problems related to posture, and of course that the neck muscles tend to get very, very tight and can be very difficult to lengthen out and release, especially if they have a lot of neck problems in general. So it can be a challenge to address, what do you address, right? And it can be difficult to address some of these things without causing injury. So we want to stretch out the chest, but that can become more challenging with people who are older, where their tendons and ligaments are less forgiving of stretching. It can be more difficult to put them into positions where they're stretching their chest properly without injury. It can be more difficult to find, let's say, a massage therapist who can address all the connective tissue problems in their upper back. Or, we can't just give them a softball and say, roll on this on the ground in order to release the muscles in your back like we might try with a younger person. So it can become more difficult, but it can be addressed. And very, very important to do so, because those knots that build up in the upper back, the connective tissue that builds up in the upper back creates a lot of problems, can prevent older people from standing up all the way. It tends to pull them forward. It tends to create neck pain, back pain, and increased risk of falls because it's pulling them forward. And it's something that needs to oftentimes be addressed. And finding the right person who can address that problem can be very challenging, because it doesn't take much. A little bit does a lot, and it can be very different from going and getting an hour-long massage. With someone who's 90 years old, that can be problematic. It might only be 5 minutes, 10 minutes of very light soft tissue or deep tissue work, and again, not very deep. Starting very, very light, being very conservative. But again, it takes that skill and attention from a healthcare provider who knows what they're doing, is familiar with the population, and has experience working with it. So a big problem, but how to solve this problem with a large number of people can be quite a challenge, because of the skill level that is required to solve the problem. So that can be problematic as well.
Hey everybody, this is the producer, Anmar here. If you enjoyed this episode, please leave us a review. If you want to subscribe to the Optimove podcast, head to www.podcast.optimovedfw.com. That's where you'll find links to subscribe on Spotify, Apple Podcasts, or wherever you listen to podcasts. Once again, that's www.podcast.optimovedfw.com. To learn more about Optimove, our practice, go to www.optimovedfw.com. And lastly, if you're in the Dallas-Fort Worth area, give us a call at 214-712-8242. That's 214-712-8242. Thanks for listening, and we'll catch you in the next episode.